Hi. So today
Hello.
I'm in sunny Berkeley. I have with me Lauren Duffy, who is in user growth at Castlight. So, Lauren, great to see you.
Yeah, great to see you, Shingai.
So let's kind of give a little bit of background. How do you find yourself in healthcare?
So I have a little bit of an unconventional background. Before I started here at Castlight, I was working at Kaiser Permanente, where I originally met you and a lot of other great folks. But before that, I actually worked in journalism and in radio. And so I ended up moving into Kaiser and working into the risk finance area, and then eventually moved into the internal communication space at Kaiser. And that was a pretty interesting way to kind of start thinking about consumers, but really just appealing also to millennials specifically, internal to Kaiser Permanente as a part of the group that we were both involved in, Gen KP, which was an opportunity for career development for specifically the millennial population. But so that was one really great experience. And then after working in Kaiser on the provider side, I moved into the health tech space about a year and a half ago. And so I've been working at Castlight Health. And Castlight is a personalized tool to manage your healthcare all in one place. So it's been really interesting to see the provider side of it, as well as the kind of the health tech consumer point of view.
Hmm. And so, how do you feel that your experience on that provider side really sort of shaped and influenced how you approach it on the healthcare technology side?
I think that's a great question. I think that it helped for me to think more about the end user, or I guess, and that sounds so techy to even say the end user, right? But just the patient,
Uh,
to think about their perspective and everything that comes into play with that. So one thing I do like from working in the healthcare space is that I'm a consumer myself, so I can think about my experience in the healthcare space. So I think it's kind of interesting from working at Kaiser, my experience going there and just what it is like as a younger person experiencing that healthcare system,
mhm.
seeing everything that comes into it, and then also coming from that tech perspective to say, okay, how can we really streamline these processes and make it just kind of a seamless experience from a patient perspective?
Hmm. Hmm. That makes sense. So, from the standpoint of the types of patients or end users that you currently work with, um, what can you kind of speak a little bit more about what you currently do to engage with them?
Sure. So I guess to give you more of a perspective into my current role at Castlight, so I work on the user growth team, and it's B2B2C context, right? So Castlight is a B2B company, but then my team, we're focusing on the consumer part of it.
Hmm.
So we're focusing on marketing to employees at different companies that buy our product. So I guess to give that, that perspective of how I think about it is that I really want to focus on putting myself into their shoes when I take that marketing perspective. So a
Hmm.
lot of it is unraveling the mystery of healthcare. I think it's incredibly overly complex. So figuring out ways that we can make it digestible and then also empower people to have the information that they need instead of having it be overly complicated. So they might end up paying more for services versus realizing that they have a better option even closer to them.
Yeah. So, what would you
Mhm.
say are some of the complexities or difficulties that you encounter the most?
I would say that one complexity is, well, one part of it is that, as I said, it's just overall a kind of a behemoth of
Hmm.
an industry, right? And so one challenge there is standardizing it. So, like, let's say I want to make content,
Hmm.
educational content, to help people learn more about their plan. But the hard part is every plan is so different. And so right now I'm working on a project of a series of interactive educational videos that we could, put on different social channels, but just really sort of like bite-sized tidbits on understanding healthcare.
Hmm.
The big challenge is that how do you standardize that across a bunch of different companies, a bunch of different health plans? So I say that would be just a big challenge. And then also another part of it, compared to other consumer marketing, would be the privacy concerns, and HIPAA associated with it. So that's a little bit of a tricky part One other challenge too would be that people don't think about healthcare all the time. Yeah. You really think about healthcare when you need it. So it could be kind of in that situation where it's after hours, you don't know what to do, so you end up going to the emergency room when perhaps you could have gone to urgent care and saved a lot of money. So just those are a few of the challenges that I've encountered.
Yeah. So what are some specific things that you've done to address some of these challenges that you face, especially when it comes to engaging with the patients, or I guess prospective patients or customers, in ways that you kind of want them to?
Definitely. So I think one part of it would be the idea of engaging with users at the right place and the right time. So as I mentioned, you don't think about healthcare until you really need it. So one thing that we're trying to tackle here at Castlight that I've been involved in is utilizing different kinds of targeting to hit people kind of with really relevant content at the right time. One project I was involved in was utilizing Google retargeting. So basically based on people's search terms. So like, let's say you're searching for an MRI near me, then it would retarget you and show you ads based on your actual health plan and say like, hey, did you know that you could find a provider near you for less money? Check it out. That kind of idea of making it a seamless user experience where you're already thinking about it, you're already there, and then being like, hey, this is perfectly relevant and targeted to you. So that's kind of one example of a project that I think helps to tackle that problem.
So do you think, or kind of how do you feel from a philosophy perspective, kind of the things that you've talked about, are these things that you find to be kind of common knowledge, at least within the health tech side of things, or are they kind of pushing the envelope a little bit? Can you kind of speak a little bit to kind of what kind of reception you're facing in terms of these kinds of thoughts?
Sure. So I would say it really depends. When we're working with different companies, there's a pretty big range of kind of innovation in thought. So I would say some companies are really early adopters, and if we're saying, hey, we want to adopt these targeted marketing strategies, what do you think? They're like, I'm all aboard. But other companies, it's just a really big variation on kind of the technology part of it too, where even, let's say the example of open enrollment or annual enrollment, it's a process that basically every company has, but they all do it really differently. So there are even some companies that still are using paper. So we're trying to figure out, these really tech savvy solutions, and it can be a pretty big challenge there. Yeah. So I would say it definitely depends, because there's just a pretty big variation overall in the industry. Yeah. But I would say that people are definitely trying to move towards more of these like streamlined solutions.
Yeah. Yeah. And can you see some of the impact or the positive effects of this more streamlined approach?
Yeah, so I would say a lot of the things I'm really excited about working for Castlight, because it's really empowering people with information that, hopefully they would already know about it, but they don't. They just have, you get stuff in the mail, you get it maybe on your insurance website. It's kind of all over the place. So it's really empowering them with the information they need. Yeah. So how it positively impacts them and having information easily available is that they can look up services and know actually how much it'll cost ahead of time. So, and I think that's something I also noticed at Kaiser too. There are these just really consumer focused tools. So for example, how you can email your doctor to schedule an appointment or video chat with them. I know that was something in Northern California, that idea. So I think it's really helping patients have a better experience in terms of convenience, but then also in terms of cost saving too. So they really know all of their options. Yeah.
And what are some of the ways that you found to kind of gather the feedback? Because I know that a lot of these new techniques and kind of figuring out how you retarget is really going to be based on some of that, what we see people actually doing. So how do you gather that?
Definitely. That's a great call out. And I would say one of my biggest learnings has been just that data is our friend. Yeah. And I would say I love just being able to dig into analytics to really see what is effective. So, for example, if we can try out an email series and do A/B testing on different subject lines, kind of bringing those best practices of technology to the healthcare space, because I think we're definitely starting to get there. Even when we were working together at Kaiser, I remember working, with the innovation team, and they focused a lot, for example, on like human-centered design and that kind of concept.
Yeah.
So bringing those best practices in tech and analytics, to the healthcare space to be able to measure the impact. I think that's huge because you don't want to be able to market, in a vacuum. You want to measure the impact. So I would say that's the big takeaway is just utilizing different analytics tools.
Yeah. So how do we keep the momentum going then? I mean, it's, reading the data, learning about that, but, what are the other things? 'Cause I know that there's a lot of organizational change that has to be done as well.
I would say just continuing down the path of personalized messages that are targeted and relevant. I would say that, there's in the past you would maybe send out a blank message to everyone, and that's not going to work. And you're kind of wasting time and money, I think, because there's some people that really aren't going to be engaged. I think you should really focus on the people where you can make an impact, whether it's helping them make better decisions about their care options, or finding, lower cost providers, that kind of thing. I think just really going down that path of digging into the data and finding targeted, relevant content, I think that's the way to just keep it going and just keep going down that path because there's so much more to be uncovered there. I almost feel like we're at the beginning of this, and then now, we just kind of have to go further down that path. Yeah.
So any quick thoughts on what the end state might look like in, say, 10 years? 20 years?
So one idea, you hear a lot about the term Uber for healthcare, right? And it's a little bit of a cliche at this point, right? But I do think that there is a lot of validity to it because, we need to bring that idea of a seamless user experience, and also the concept of transparency too. We need to bring that idea to the healthcare space because still, as of now, it feels like a pretty big hassle. And it's this thing outside of your life that isn't a seamless integration. So I think just finding out ways to integrate it into your life, whether it's on your phone, whether it's just a really convenient doctor visit that's right in your neighborhood at a clinic, I think that's really where it needs to go. So it's just like any other consumer service. It's not another, outlier outside of your life.
Yeah, no, that makes sense.
Yeah.
So any last words?
I don't think so, but, I just love seeing the innovation in healthcare, and I think it's a really exciting industry.
Yeah. Well, we look forward to seeing more from you and from Castlight.
All right, great. Thanks so much, Shingai.
All right. Yeah. Thanks for hopping on.